COMMAND-HF is a trial which very specifically focused on patients with severe heart failure because these patients were discharged short before randomization from an episode of heart failure hospitalization. And this specific situation is a high-risk situation and with no cure so far because we have been attempting a variety of medication into a variety of trials and all of them have been negative so far. So we were struggling in order to find a solution, and we said, well, why not thrombin? And coagulation produces side effects and effects on the progression of the disease, including endothelial dysfunction, inflammation, and microthrombi, which all may produce worsening of heart failure. So the primary outcome was a composite of all-cause death, stroke, and myocardial infarction, and we had to have a large enough trial in order to seek for superiority. And the population were all patients with coronary artery disease and no atrial fibrillation. So the outcome is neutral effect on this primary outcome. We had looked at a number of composite of the component of the composite endpoint, and it looks as the thrombotic events may still be favorably influenced in the subgroup population, but this is diluted in so many non-thrombotic events which were not influenced by antithrombotic therapy. The take-home message is that patients after discharge from heart failure hospitalization have mechanisms which produce worsening of heart failure which are not necessarily thrombotic. And this is a hypothesis which we have been thoroughly tested, and now we have an answer. Now, within the heart failure population, whether they are stable or in other conditions, if they have high risk of thrombotic events, and we can find out actually risk predictors of thrombosis, they may still benefit from therapy, and this comes from other trials, whether the ATLAS-ACS trial or COMPASS trial and the heart failure subgroup analysis, which show that indeed these patient populations are at still high risk of thrombotic events, but they are stable heart failure, not being driven by the pump failure and the heart failure driven events.